And it's phenomenal once you do that session. In fact, I'll propose Dr. Garth to organize a session next time. I'll actually do a session for all of you so that you can experience that shift. And I work with leadership organizations, private, public sector organizations who are in very highly stressful jobs. And then instantly they experience that shift. So hopefully I've answered your question. Thank you.
I thoroughly enjoyed all the presentations this morning, particularly this one on mental health and meditation. Looking back in 2011, when we put together the UN high-level summit's recommendation to non-communicable disease, it appears blatantly we missed mental health, but we did not. We have got at least 2 recommendations from those 64, but that has not been put out in larger scale. But the work that people like you doing in British Columbia should be exposed at the global level. That's when we'll get the scaling up, somebody found the scale. And the scaling up should reach out to the masses. I think it's phenomenal work. Just as a point of interest, we do have a journal for non-communicable disease, and I invite most of you that have done some wonderful work, Roshni Clinic and your PhD, they're all worthwhile to be talked about from a scientific perspective, so that it is not considered only as esoteric. So it should be come out in the full limelight. We'll be happy to publish, we'll be happy to consider it.
Thank you very much, Dr. Choklin, for your advice. Yes,
Is there any cross-link between meditation and yoga?
Okay, now we are going to the whole ancient wisdom. We're opening up the Pandora box. Good question. Yes, the yoga itself, which comes from, of course, ancient India, meditation is an element in the yoga, right? The whole purpose of yoga is to feel that oneness of mind, body, and soul. And of course, when we talk about soul, which is kind of a word that is not need to be used in scientific conference, but I'm going to kind of touch upon that. Soul, there's a lot of misconception on it. Soul is nothing like an abstract philosophical concept out there, but it is that subtlest state of pure vibration of energy. It's very scientific, actually. It's a very scientific. If you look at dissect yourself, literally go down scientifically into your body, it's made up of trillions of cells. And each cell is made up of sodium, potassium, iron, magnesium. You go down further, it's nothing but subatomic particles, electrons, protons, neutrons. You go further down into electrons, it's made up of quarks. And the modern physics now finds, the quantum physics, that between the quarks, there is this huge space of energy. And that energy is actually creating these particles. And what actually happens in meditation, at least from my experience and what I've seen with people, is you basically tune into that silent, subtle state of energy, that calming energy. And that is where you feel that oneness with yourself. And then naturally, you start to feel oneness with everyone. And that is the whole essence of yoga. Now, meditation is one aspect of yoga. I mean, in the modern context, yoga has been kind of classified into 8 steps to get to the final state of blissful, joyful, happy state. And dhyana, which is called as dhyana in the ancient wisdom, is meditation basically. So yes, yoga and meditation are tightly integrated, but it doesn't have to be practiced with what the modern yoga, the asanas part of it, but you can tune into that anytime. Like I said, the DS techniques works wonders, my dear friends. You could use that, like I tell my friends and in sessions, you could use that while you're listening to a talk. You could, while you're driving, where the mind wanders. If you look at our mind, it acts like a monkey, constantly going into the past and the future, right? So using those simple techniques, you can become one with your true self, going beyond these dualities of pain and pleasure, experiences and emotions and entanglements. Hopefully. It's a big topic, so I kind of tried to. Thank you.
Probably time for one more.
Yes.
I'm just curious about,
sort of this discussion has been all about coping strategies, I think, fundamentally. And I guess I'm curious about what, if any, physiological changes can be measured from the meditation practices, and how do they need to be maintained in order to be effective, or are there sort of real underlying changes that actually occur as a result of doing that?
Absolutely. Fantastic question. So first question is, can we measure the physiological changes? Yes, there are innumerable studies, simple things like measuring cortisol, measuring inflammatory markers, phenomenal transformation in those areas. There are published research papers on that. And physiological changes in terms of brain structure, gray matter in the brain. They have found that people who meditate, who have been having a lot of stressful and anxiety disorders, have amygdala which is kind of swollen. But now, after practicing meditation for 8 weeks, they have found that amygdala size shrinks, right? And they have found that the prefrontal cortex, which is responsible for self-awareness, self-regulation, decision-making, there is thickening of prefrontal cortex in that area. So these are like phenomenal research. There are pioneers like Dr. Richard Davidson, Dr. Dan Siegel, and innumerable people, Dr. Elizabeth Hogg, who's an addiction specialist. And there are many more people whom I kind of follow their research and their work, who have documented this work for like past 2 decades. So that's the first part of the question. Second part is, do we need to continue this? Yes, it is. I call meditation as cleansing the mind. We take the bath every day to clean the body, right? So similarly, if we can make this a practice to cleanse our minds every day in the morning, I clean my mind 3 times a day. First thing in the morning before I get out into the world, during my lunch break to again cleanse all those clutters and all those experiences that we accumulate, and then at the end of the day. So I think as a culture, we have never been trained or taught about these practices. And most of it has been looked at as spiritual or religious practices. But if you look at it, it all came from human search for the peace and joy and happiness and fullness experience, right? So today, I think I work with kids in schools, teachers in schools, and they all love this. Once they make that, I have a 15-year-old teenage daughter, so I can see their plight, and the moment they make this part of the practice, I give my daughter meditation session when I'm dropping her at school. I have that 15 minutes because that's the only time she gives me, right? So yes, it will be, I think as a cultural shift, we need to start making some of these, like dietary changes, like, suddenly we have this surge of, no carb diet, low fat or high protein diet, or organic diet, more high fiber diet. As a culture, we are all shifting towards that. So I think for mental health also, there can be a lot of these coping strategies as a culture with scientific background, scientific research backing it, and establishing centers like Sahed and other organizations can take that into community. Like I said, we are doing this as a one-man army, but more effort, more collaborative work will happen.
I'd like to add that, it is an area of robust research
Yes.
in the field of neuroscience, psychiatry, and mental health. It's even permeating sort of the work in management and leadership and crisis resolution, talking about meditation and the role of the prefrontal cortex and amygdala. It was spoken about quite a bit last week. And the role of meditation actually in getting people out of the more primitive centers of our brain and into more productive centers of our brain, which obviously are prefrontal cortex. It's fascinating, and the evidence is emerging, and it's actually quite compelling and robust. And so there's no doubt about that. Dr. Puri, I'd like to ask you a question, because you spoke about the numbers of people accessing your clinic, such an important initiative for us in our health authority. How do you think obviously there's still a lot of work to do, and a lot of work in engagement and destigmatization. What do you think some of the keys will be in terms of bringing people sort of out of the shadows?
That's a great question. And before I answer it, I also want to comment, the evidence is clear for meditation. I think where some of the questions I'm holding around that are, how do we actually, like you said, make it a part of our daily routine? I tell every single patient that walks in through the door about meditation, but to construct a sort of a system around them, a daily life around them in which they feel that they're enabled to practice it in a long-standing way is possibly something, and maybe we can talk about that after, around